Right on. Well, let's get started. So, thank you guys so much for being here today. I'm Coach Chela.
And I'm Coach Dave.
Very good. Today, we hope to have a robust discussion about the doctor approved Cannabis Handbook by Dr. Benjamin Caplan. I'm a family caregiver turned advocate and cannabis coach. With my husband Dave, we co created the Cannabis Helps Dementia podcast and Coach Chela Canna Guides after caring for my mom during her near decade long journey with Alzheimer's. We support people living with chronic illness and their care partners with compassionate, plant based approaches. Dave is 19 months seizure free, and my dad is living well with Alzheimer's with us at home. My older sister has a rare brain disease called progressive supranuclear palsy, and cannabinoids even help with her quality of life as well. Let me get into my book report on the doctor approved Cannabis Handbook by Dr. Benjamin Caplan. When someone you love is facing a complex or frightening diagnosis like dementia or cancer, you don't just want information, you want clarity, you want a path. You want hope backed by evidence. That's what makes Dr. Benjamin Kaplan's The Doctor Approved Cannabis Handbook such an essential and empowering read. Dr. Kaplan is a family physician and cannabis medicine specialist with decades of clinical experience. In this book, he translates complex science into something that's readable, relatable, and refreshingly practical. Whether you're brand new to plant medicine or already exploring cannabis options, this book is your reassuring guide. What struck me immediately is how readable the book is. Even for people with no science background, it's conversational, even warm, and full of compassionate wisdom. You'll find patient stories, evidence based summaries, dosage tips, and practical tools to help make cannabis feel doable, not daunting. Dr. Kaplan organizes the book by condition so readers can go straight to the chapters most relevant to them or a loved one. For those of us focused on supporting brain health and memory, there's an excellent section on Alzheimer's and dementia, which I'd love to read a little bit from. So, some brain illnesses stem from poor diet, poor exercise, poor physical health, stress, anxiety, depression, mental illness, and especially poor sleep. Cannabinoids can assist us with addressing many of these issues. They can help us get better sleep, which reduces stress and provides the opportunity for the brain to adequately process the day's activities, thoughts, feelings, and memories. This full reset every night is not only important for maintaining good physical and mental health, but for making healthy choices when it comes to diet and exercise. And by maintaining a more stable mood, you can enrich social relationships, which we know is essential for maintaining healthy brain function. I'm going to skip down a little bit to just my highlighted bits. When we take in additional external cannabinoids and their related flavonoids, we're increasing our supply of antioxidants. Further down, lastly, some brain illnesses have a genetic component. When this occurs, brain cell death is often linked to damage of the basal ganglia, a series of connected structures in the brain related to movement and learning. This area is densely packed with cannabinoid receptors, whether they're appropriately functioning or not, determined by your genetic makeup. While more studies need to be done, some researchers believe that cannabis therapies may have a direct impact on preserving function in this area by helping the brain release the chemical dopamine or addressing damage. What's more, cannabis directly affects your epigenetic expression, where the thriving activity of healthy cells reduces your risk of developing genetic issues in this area of the brain. This is super important for me personally. For these reasons, cannabis may be a therapy that addresses the root cause of poor brain health, particularly in the three most common areas that afflict adults: dementia or Alzheimer's disease, vascular disease, and Parkinson's disease. In fact, it's not merely the least bad option, it's a great option. I love that part, of course, because I'm very concerned about this for my own brain. Further into the chapter, um, a couple pages later, as cannabinoids are strong antioxidants, they protect the brain from damage, including oxidative stress. They're also shown to be an effective strategy in animal studies for creating new brain cells via neurogenesis, as well as stronger nerve to nerve connections, which help brain cells thrive. So important. It's very, very exciting. And we are trying it out ourselves on our loved one living with Alzheimer's. Okay, so this section beautifully echoes what we've learned in our own family's journey with Alzheimer's and what so many experts on the Cannabis Helps Dementia podcast have shared. Cannabis isn't a miracle cure, but it is a valuable tool that can restore calm, dignity, and connection. And that's no small thing. Anybody in relationship with dementia knows that. This book also offers insights to cannabis for care, another topic close to my heart. Whether you're coping with pain, appetite loss, anxiety, nausea, or the emotional toll of treatment, cannabis can offer relief and resilience. And again, Dr. Caplan lays out the evidence, patient stories, and clear guidance that makes trying it feel safe and supported. From the chapter on cannabis and cancer, the science does exist. Sorry, let me start over. The science that does exist is not well documented or supported and has not passed yet another critical step for it to be trustworthy: reproducibility. Most of the impressive research has been conducted on the microscopic level in petri dishes, looking at how cancer cells respond to the presence of different cannabinoids. We talk about this all the time with our clients, with other books that we've reviewed previously. We take those studies and we try it because it's not going to hurt. Okay, continuing on in our book, he talks about some of his clients. Where he says so many of them are doing great, meaning that they are completely cancer free as long as they stay the course and remain on cannabis treatment. We see the same thing with our clients as well. Later down on that same page, no matter where you or a loved one is on the cancer journey, there is a role for cannabis that merits serious consideration. You have nothing to lose with this experiment and everything to gain. All right, further on in this chapter, not only does cannabis distract you from rumination and worry, it helps you look at your life through a different lens. It can help you tune out distractions, including your emotional turmoil, so that you can understand the situation with clarity and focus. Cannabis can help you shift out of the scenery of everyday life and open up a space where you can really think about a serious change in those variables. Cannabis can also help you turn down the volume of extreme emotion. So important. Further on in the chapter, cannabis can change the signaling, activating cell death by opening channels of communication where the cells can once again remember that they are supposed to self-destruct. By doing so, cancer growth is stopped. And he refers to the study where that is found. Cannabis offers the opportunity for interruption of typical cancer cell proliferation signals at the genetic level. The cannabis is not killing the cancer cell, it's impacting the process of normal cell life. Cannabis can also interrupt other stages of the proliferation process. At many stages of the life of a cancerous cell, it becomes less viable when cannabis is on board. We totally see that with our clients as well. He talks about different regimens and for different cancer symptom treatment. And one of the things he talks about is the GI issues. So cannabis can treat GI issue side effects more effectively than any other pharmaceutical, and choices higher in THC can increase appetite, but you don't need a lot. Cannabinoids bind to and activate opioid receptors. For instance, topicals can be used both to prevent and heal damage from radiation. Continuing on in the regimens for cancer treatment, it is believed that a large volume of cannabis is needed to achieve tonal change and make a lasting difference. If there are 10,000 pieces of cancer, it appears that you may need at least 10,000 pieces of cannabis to interact with localized cancer cells. So we see it also, cannabis works at killing cancer in a dose-dependent manner. So you got to use enough cannabinoids to attack the cancer and make it not be able to live. Okay, back to our book. while taken systemically, the killing action of cannabinoids is limited only to cancer cells. That's important, much better than with chemo. Further on, um, oh, however, once you develop a tolerance to THC, he's talking about, unpleasant feelings will go away, and you'll eventually find that further increases in dosing are less likely to come with discomfort. Most of our clients are come to us because they want a non-impairing protocol. And we're finding that starting with all those non-impairing cannabinoids really does help if they ever do want to increase their THC later on down the road. Here we go, back to our book. The approach to treatment is to consume a huge amount of broad spectrum flower featuring both THC and CBD, as well as many other cannabinoids, as quickly as you can tolerate. The more variety you can handle at the same time, the better. Yes. So let's see. Further on, a few more pages. Okay, this is important. It appears that once you've found cancer fighting success using cannabis with or without traditional treatment plans, you can lower your level of consumption to create a maintenance dosage if you achieve remission. Around, for his clients, it seems like around 25% of your maximum dose. But further down, it says, this means that when people use cannabis to fight cancer, it is thought to be a permanent therapeutic option, at least until a deeper understanding is found. You have to stay on cannabis medicine. But cannabis medicine helps with so many things. It's not a bad thing to do. So further on, under dosing, I loved reading this because we do the same exact thing. And it's just so validating when I see that the people, the healthcare professionals are doing the same sorts of things. So under dosing, Dr. Caplan says, I typically recommend starting with moderate to high doses of CBD on the order of 100 to 200 milligrams daily, preferably 1 to 4 times a day, as frequent as possible. Same here. We like to recommend the same thing. The ratios of euphoric and non-euphoric cannabinoids should be adjusted to your instinctual preference. We run along the same road there too. If you're not experiencing sustained effects all day, you need to increase your dosage. Don't wait until the effects completely wear off before you take the next dose. Further along, under interactions and other medications, we need to be mindful when we're using biologics, T-cell therapies, cancer vaccines, and oncolytic virus therapy and treatments that have immune-dependent effects, such as doxorubicin and cisplatin. It's important to work with somebody who knows how to manage these traditional standard of care therapies with cannabis medicine. So let's see. He talks about when you cannot access legal THC. And also, he does remind people to consider pre-treating cancer. So from the moment you get your diagnosis, it's usually a bit of time before you start treatment. So during that little window, he recommends to start using high doses of non-impairing cannabinoids, including CBD, CBDA, CBG, CBGA, CBC, and CBCA. CBCA is a little hard to find, but the rest you can totally find at the resources we like to recommend. So the cancer section is really great. He gets into all kinds of interesting things. Some of my clients complain that these books that these doctors write don't get into the specifics of dosing well enough. And it's not because they're trying to be cagey. It's because everybody's different. And there aren't enough studies to be able to pinpoint exactly what's what. So it's important that you listen to your instinct. It's important that you pay attention to your body and that you take notes and you write these things down because it's so easy to forget. You got so much going on. Okay, so that is it for the cancer section.
Yeah, I can talk about the seizure section, which is,
That'd
of
be
course,
awesome.
where I paged through or two after I read the opening. And just about the opening, it's, like I say, it's in 2 sections. The first part is a guided cannabis overview. That, a lot of the cannabis books that we review and talk about, they all provide a little intro to cannabis, and this one is no different. But one of the things that stuck out about me, or about this particular one, is, and let me make sure I got the right section here, is, yeah, it talks about, of course, the cannabinoids, the major ones, THC and CBD, but he does a really great job of listing and talking about the benefits of all of the, or a lot of the minor cannabinoids. Of course, we know there's some research says there's up to over 200 different cannabinoids in the plant. But he does a great job of breaking down the more common ones, some of the ones that are more readily available to consumers, and what they can do for you and what the science says. He also looks at all the terpenes, which is not often found in many of these cannabis books. And he has a big list of terpenes that talks about so many, and a lot of these I really did not know about, and breaks down how they are therapeutic and how they can help with anti-seizure, anti-cancer, and any other number of ailments, because of course the endocannabinoid system is everywhere, and there are receptors all over the body. So yeah, this list of terpenes is really, really extensive, and some of them I have never seen before. And they're all different. They are all available to certain degrees in different cannabis that's out there on the market, but many of these are isolated and put into products. But this just gives a great breakdown of the many that are available. One, of course, that we are very familiar with is beta carophylline, which is readily available through Dr. Blair has a product of beta carophylline, and it has some amazing effects: anti-anxiety, anti-cancer, anti-convulsant, which is particularly beneficial for me because of my seizure disorder, recently diagnosed, now 19 months seizure free, as Chela mentioned. Antidepressant, anti-diabetic, anti-inflammatory, antiplatelet aggregation. The list goes on. Alzheimer's, Parkinson, it's good for so many things. He even gets into flavonoids, which is really an obscure constituent in the cannabis plant that not many people talk about. But there's definitely therapeutic effects to all of these flavonoids that are in all, if not some, of the different cannabis plants. And this is quite an extensive list too, most of which, I'm saying maybe almost all of which, I have never heard of. But once you get through that part, which is a great, easy read, you can certainly go to and just skip through to the chapters that you're interested in. And I went right to seizures. And he gives a nice breakdown of what's going on in the brain when you start to have seizures. As many of you know, or some of you know, I started having seizures in 2023. Is that right, Chella? Yeah, I think that's right. And I am now 19 months seizure free once I found my dose of CBD, CBG, and CBDV, also some THC. But some of the highlighted areas of the book that I found to be interesting: seizures are one of the few diagnoses where traditional medical community accepts cannabis as an effective therapeutic agent and has seen dramatic improvement and patient satisfaction with its use. The reason for acceptance is purely data driven. Over the years, I've treated hundreds of epileptic patients and have seen dramatic positive results. Many of my patients report up to 80% less seizure activity. Most have previously tried all kinds of seizure medication or medicine combinations, yet they still complain that these medicines seldom provide the relief they're looking for. Either the medications don't work or the side effects from them are not manageable. Oftentimes, traditional seizure medications may be overly sedating or have unbearable side effects, such as diarrhea, dizziness, or fatigue. I had some side effects with Keppra, which I am on. I also then added CBD at the dose and recommendations that I have from a couple of cannabis doctors, and my seizure became controlled. And then on some other advice, I stopped using a particular CBD I was using, and a week later, on the Keppra, I had another seizure. So I went back on the CBD at the appropriate dose that I was using. I take approximately 1,000 milligrams combined of the CBD, CBG, and CBDV, and that seems to have stabilized my seizures. So I'm happy to be only on the Keppra and the CBD, or the cannabinoids, as part of my regimen. And this is really powerful. The anti-seizure effect of cannabis is powerful, often yielding success when other treatments fail and boosting results of traditional therapies dramatically. Cannabinoid molecules are thought to attach to the same GABA receptors, dampening faulty nerve signals and repairing them. Cannabinoids don't necessarily shut down systems with as much intensity or force as pharmaceuticals do. Instead, they act as an effective anticonvulsant that can both decrease acute instances and prevent them. Historically, matching the right medications to seizure type was important. However, no matter the cause, guided cannabis works. Cannabis is user controlled with appealing forms of administration, convenient options for scheduling, and almost all pleasurable without adverse side effects. It can be used preventatively to reduce seizure frequency, which is what I do, and is needed to reduce intensity. Which is what I have. I have a THC inhaler in case I do have a seizure. Um, there are also people who take cannabis at night because they want better sleep, and in fact, poor sleep is one of the triggers. So, a really good seizure section talking about why it works so well. The only, well, not the only, but the first all natural cannabis drug approved by the FDA is Epidiolex, which is a seizure medication
I
without
wouldn't call it all natural.
right, exactly, with
Mhm.
sugar and
It
alcohol
has
and
sucralose and ethanol.
right. And it doesn't have any THC in it either. It's just CBD, and you have to take a higher, very high dose of that, which is not necessarily higher than what I'm taking. But I am using full spectrum CBD so for as long as I can, so that I do get flavonoids, I do get the terpenes, and I do get a little bit of THC that helps the CBD work better. And also, as we heard in the cancer section, Chela was talking about, CBD also helps the opioids work better. So good stuff all around with as far as working with seizure medication and overall just reducing that brain activity to keep it below that threshold so you don't have a seizure. And he talked about his patients that he uses these products with are just you know almost to a one or having much better, fewer seizures, fewer intensity, just overall good stuff. So that's my take on that seizure section. And generally speaking of the book, it's definitely a good one to have on the shelf.
I've given it to doctors for Christmas as well. Yeah. So I definitely give these books away to healthcare professionals. It helps a lot. Other parts of the book that I really love that it centers real people. He has lots of little sidebars of his clients, his patients that he's worked with, and it doesn't just talk about diseases. It respects the whole person and the caregivers too. It acknowledges the emotional, physical, and spiritual complexity of living with illness and offers cannabis medicine as one of many tools that can make the journey gentler. This book belongs on the shelf of every senior center, every oncology office, caregiver resource library, and home where people are trying to feel better and live better with less fear and more options. If you're curious about cannabis, but overwhelmed by conflicting advice, start here. Dr. Caplan gives you the science, but also the humanity. I highly recommend the doctor approved Cannabis Handbook as a trusted, readable companion on the path towards healing, comfort, and empowered care. Go get it, guys.